Hello, family. So, for some people, the reason why you have a protruding stomach is not necessarily because of excess fat. Yeah, for some people, it's actually excess fat. For some people, it is fatty liver disease. For some people, it is abdominal separation. There are two types of belly fat or protruding belly, big belly, whichever word we want to use, that people are typically confronted with. You have the protrusion at the middle of the stomach, right? And then you have Fupa, that is usually common amongst women. Fupa is usually common amongst women. That's just fatty. That just means fatty upper pubic area. You see that sag at the bottom of your belly, that you see. Now, most of the time, uh, Fupa is as a result of excess skin, right? When for whatever reason, whether because you were overweight or you carried a pregnancy and then you have lost the excess weight, or you have delivered your baby, and then gotten back to your pre-pregnancy body size, and then the skin, the stretching of the skin makes that sag, to be there when you have gotten back to your normal weight. Now, for FUPA, the stretch after a while, provided you are doing what is needed to be done, gradually your skin can, snap back, not necessarily to normal. You see, like when you blow a balloon and you deflate, it may not return back, to its actual size before you blew air into it, but then it can at least contract back to some extent, right? With necessary tips in place, you can actually achieve not I always say this, forget about having, you want to look like a model or whatever, you want to look like Naomi Campbell and all of that, and just focus on getting a functional body, and still, of course, looking good, because looking good is still important, but have it at the back of your mind that not everybody's stomach will be flat. Do you get it now? But then at least you can achieve some level of flatness that can make you look good, make you healthy internally, and still make you look good aesthetically. That's that. But then one of my major concerns, because it's what affects a lot of people, right, especially for women who have carried babies, is abdominal separation, right? And so my next YouTube podcast is going to be on, is going to majorly be on how to gradually reverse abdominal separation, right? I'm going to be talking a lot on that, on how that happens and how you can work on reversing it. I might throw in a thing or two about how to also deal with FUPA. But remember what I said, especially with FUPA, you may not always achieve 100% flat, but then you can get your stomach to be reasonably flat in a way that makes you look good in clothes and then still healthy internally. Hopefully, by next week, I am going to be working on that.